Welcome to the Gold Coast Plastic Surgery Podcast. I'm Dr. Mark Doyle, specialist plastic surgeon with over 30 years experience. Today I have with me my friend Elena. Today we're going to be talking about all things plastic surgery.
Mark, I've heard a lot about fat transfer from other parts of the body to the breasts.
Yes.
What are your thoughts on this operation?
Oh, this is the dream. This is the dream of women. Take my fat and put it into my breasts. Sounds good in principle. In practice, it's not so good. I'm not a fan. And the reason I'm not a fan is that we need to take fat from somewhere in the body to inject it into the breast. In order to do that, the fat has to come out of the body. So it's quite happily sitting in the body somewhere. We remove it from the body, then we have to treat it and then put it back into the breast. During that period of time, there's no blood supply to the fat. And taking the fat out, because we need a good volume to take out in order to make a difference to the size of the breast, the problem is that not all of the fat takes. The sort of standard teaching has always been about 80% of what you inject takes, but that can vary anything from 0 to 100. We have two breasts, so if we put, say, 200 grams of fat in each breast, there's no guarantee that there'll be 200 grams afterwards. And the problem is that because you may find one breast doesn't take any, and the other breast takes 80%. This operation is one that is really difficult to predict a result, and therefore not a favourite of mine. So although it's a great dream, in reality the results can be problematic. The better option is using fat transfer in very small amounts. So if somebody on the breast, say, has got breast implants in and they've got a ripple or a little bit of skin that's a bit loose and it could be filled out a little bit, putting a little bit of fat on it, that is okay. But most people that were wanting fat transfers to breast was to get a big change in the size of the breast, and it is not a good procedure for that.
So if a woman is looking for a consistent breast size in both breasts post-surgery, are implants the only option? Yes,
I believe so. Particularly if you've got volume. If you've got a volume deficiency and you need significant volume to change the shape of the breast, fat transfer is not the answer, breast implants are. Thank you for joining us today on the Gold Coast Plastic Surgery Podcast. It's been a pleasure to have Elena with me today, and I hope we've answered some questions that you find relevant.